Okay, I started with a statistic from the Road Safety Authority, which was a figure from 2017, 157 fatalities. Very regrettable, but it was a decrease on the figure the previous year. And we know the extent of the campaigns by the RSA. They're high-profile, impactful TV campaigns, and the RSA say that they're making a difference. And surveys that they've done also say that adults are affected and influenced by those campaigns. I want to compare and contrast a different statistic, and that's drug-related deaths. It's not a direct year-to-year statistic because the statistics don't work that way. In the last recorded year for drug-related deaths, there were 695, 3.5 times higher than the deaths on the roads. And then Eurostat this morning brought out a statistic that Ireland is 3 times above the European average when it comes to drug-related deaths. So I have to ask, how seriously are we taking the drugs issue? Now, we know the facts, we know the increase in the rates of drug use in Ireland, particularly among young people, and we know generational drug misuse and abuse, and we know the unhealthy relationships we have, Irish people have, with drugs and alcohol, the massive damage to families and communities, and we know the bills in health and also in crime, and we know the links with sexually transmitted illnesses as well. Now, Taoiseach, you launched the National Drug Strategy last year in Dublin Castle, and you said all the right things in recognising the problem that it is a public health issue. There is a need to combat the underlying reasons for drugs, the need for effective intervention, and you also recognise the importance of community participation in key decision-making structures. I want to refer to 2 recent events which really highlighted the need for that communities to be in the decision-making process. And while they were both located in Dublin, the issues that I'm talking about, our drugs, are national. Friday last, Minister Bruton launched Let's Get Specific on prevention and education, and the strong recommendation there was that there was a need for a collaborative, multi-agency approach, community and youth projects with the schools working together and also listening to young people. And then yesterday in Croke Park, a conference hosted by the North Inner City Drugs and Alcohol Task Force and also by the Programme Implementation Board on drug-related intimidation. And it heard very frank accounts from those who are experiencing intimidation. Intimidation to pay money, intimidation to attack homes and houses, and also one very frank account of an intimidation to carry out a murder, all because of drug-related debt. And even though we see a strong commitment between the community and the Divisional Gardaí, various surveys have found there are low numbers reporting, such is the fear of reprisal. And again, the strong recommendation, a multi-agency approach, statutory people who can make decisions with the community, not linking with the community, but that the community are there in that decision-making process, because that would recognise the good practice that goes on in communities, and would also recognise the wealth of experience and knowledge that communities have. So I'm asking that we do commit to that collaborative approach where the communities are part of the decision making.
Thanks very much. I wanted to thank the Deputy for raising 2 very grave matters, both road safety and drug-related deaths. And we both know that deaths on the road and deaths related to illegal drug use cause hundreds of deaths every year in Ireland, hundreds of deaths, and one is too many in my view, but often people who are struck down long before they should do, often in their 20s and 30s and 40s and 50s. The number of road deaths has fallen considerably over the past number of decades. It used to be well over 600. It's around 150 now, but that's still too many, and there is evidence that it may be rising again this year. And what's required in that regard is that we continue to support the RSA and fund the RSA well to do the advertisements and other information programmes they do, that we step up Garda enforcement. We have 600 more Gardaí than we had only 2 years ago. We need to make sure that some of them go to the traffic corps, and we've increased enforcement. And also we need to focus on legislation too, and the road traffic bill is currently in the House, and I'd encourage deputies to support that. I don't think it's right to say that something like road deaths and drug-related deaths are directly comparable. The phenomenology and the reasons behind drug-related deaths and road deaths are very different. But I think the point the Deputy makes is well made, that there are many more people now in Ireland dying of drug-related issues than dying on the roads. In terms of what we can do about it, we do have the the new national drug strategy, which is being implemented, only published a few months ago, but is now being implemented. We have greater availability of naloxone, which is really important in rescuing people from an overdose. And I think in time that will demonstrate and help bring about a reduction in deaths by overdose, because the more available naloxone is, whether it's to paramedics, to key workers, or even to families and friends, the more people who can be rescued from overdose. We're also reviewing our overall approach, and Minister Byrne has appointed a commission to examine the whole issue of decriminalisation, as to whether we should move away from the current approach, which is one of criminal justice, to one where we decriminalise minor possession of what are now illegal drugs, in an effort to move away from a criminalising system to one that may be more health orientated. And also we have approval now and are making really good progress on putting in place our first injecting room in Ireland, in Dublin, thus allowing people to inject more safely. And people know the health benefits and lives that may be saved from that. I absolutely agree with the Deputy that to deal with an issue like this, you need to have communities involved, and you need to have them integrated in the decision-making process and the implementation process. And I think the point she makes is absolutely correct in that regard. And I know it's something that Minister Byrne will take up and run with as well.
Point of comparison. I'm not on again. There's something wrong with this. The one point of comparison is nobody wants any deaths, but where there is a will, something can be done about them. And both of those deaths, whether it's through road traffic or through drugs, can be prevented. And I just ask myself what those who are watching this, who hear your reply and see what's happening, those who are in addiction, their families, their communities, those who are in recovery. I think about the community workers, the youth workers, the counsellors, the teachers, who are all at the forefront. How much confidence and hope they get from what you said. We're rightly horrified at child abuse, but there are children and young people who are victims of drug dealing or who are perpetrators of drug dealing, and that's also a child welfare issue. And another fact, we know the extent of the cuts, 30 to 37% since 2008, to those projects that are working directly at the forefront. They are now dealing with more complex, more difficult, more traumatic situations, and I think most of the task forces would agree that they're seeing a doubling of the numbers. You know, the slogan yesterday in Croke Park was, "This is not a talking shop," and it is time for the talking to stop and for the implementation of the new strategy.
I can assure the Deputy that this is something that government is very aware of, something that government is very concerned about, and you're right to say that the will to bring about a reduction in road deaths, the political will to do so, made a big difference. Although the phenomenology, of course, around road traffic deaths and deaths related to drug use is very different, but it did require some of the similar things. It required education, it required political will, it required legislation, and required a change in approach and a change in tolerance to certain behaviours like drink driving, for example, speeding, and so on. We have a national drug strategy that is being implemented. I mentioned already how the greater availability of naloxone is saving lives and will save more lives into the future. I've mentioned how we're reviewing the whole approach to criminalisation, and whether we should move away from a criminal justice-based approach to one that is about health. And I look forward to the report of that body on that. In relation to task forces, they have had their budgets cut over the years, although I think in recent years the budget has either been held steady or has been increased in some cases. Certainly the budget for social inclusion within the HSE has been increased and was increased in the last budget. But we always need to bear in mind, when it comes to any of these local implementation bodies, whether it's a drug task force, we have to compare one with the next one, see if some are getting better results, because we know from so many things in society that more resources doesn't necessarily mean better outcomes, and we need to make sure that we put the resources behind policies and implementation bodies that produce results.